Est-ce qu'on fait les
Mr.
autres
Rahman,
rangements?
good morning. This is Geneva speaking.
Pardon?
Do you hear me?
Est-ce qu'on fait les autres rangées?
Yes, I do
Petite
hear
seconde, j'ai
you.
besoin de réfléchir.
Thank you.
2 secondes?
Yes.
2 secondes.
If you can switch on your camera in order to check a little bit your picture.
Yeah, sure. Is it okay?
Here we are. I can see you now. Could you adjust your camera in order to take away a little bit the space on your top?
Oh, okay.
Just lower down the camera a little bit.
Is this
That's
better?
much better. That's much better. Thank you very much.
Thank you.
Thank you. Thank you, sir.
Hi, Enrico, can you make me co-host again? I lost the status.
Yes, I'll do it.
Thanks. Hello, Mr. Rahman. This is Elma from UNTV. We saw you earlier. If you want to start your video and mute yourself, I can test your camera and sound.
Elma, I already tested them.
Okay, thank you. Hello, Mr. Rahman. My colleague says that he already tested your camera and sound. Can you hear me okay?
Yeah, I can hear you now.
Okay, that's great. Thank you. I'll switch off your camera and mic until later on.
Thank you so much.
Recording in progress.
Good morning, and thank you for joining us here at the UN office at Geneva for this press briefing today, the 9th of February. We have quite a number of important issues to discuss today. We have Sudan, we have Iraq, we have Haiti, we have the global dengue situation, and we have the Global Supply Chain Forum also coming up. So we'll start off immediately with James Elder of UNICEF, who's got an update on Sudan.
Well, thank you. Hi, good morning, everyone. 300 days ago today, a wave of atrocities were unleashed upon the children of Sudan. Here is some of what's happened in that in that 300 days. First, the world's largest displacement of children has been seen in Sudan. 4 million children have been displaced. That's just over 13,000 children displaced every single day for the past 300 days. Safety gone, worldly possessions gone, hope fading. Second, the consequences of the past 300 days mean that more than 700,000 children are likely to suffer the most dangerous form of malnutrition this year. UNICEF won't be able to treat more than 300,000 of those without improved access and without additional support. In that case, tens of thousands would likely die. Third, there's been a 5-fold increase in verified cases of killing, sexual violence and recruitment from a year ago. That equates to a terrified number of children killed, raped or recruited. And these numbers are, of course, the tip of the iceberg. Fourth, 2/3 of the population now lack access to basic healthcare. This then is a war that's destroying health and nutrition systems, and that is killing people. This is a war destroying the concept of respect for the laws of war, and that is killing people. This is a war destroying families' ability to fend for themselves and protect themselves, and that is killing people. But this is also a war destroying opportunity, and that destroys a country. The true cost of war isn't measured just in casualties, but also in the loss of intellectual capital. And this war risks condemning Sudan to a future bereft of learning, innovation, progress, and hope. I was last in Darfur 20 years ago. When I returned this past week, I heard many stories of deaths from nutrition and deaths from violence. But I also met countless 20-somethings for whom dreams had died. Those youth were small children when the massacres occurred in Darfur 20 years ago. Somehow their families kept them safe from that horror. In the preceding 20 years, they have latched on to life. Those I met, both in Darfur and the newly arrived refugees in Chad, had studied or were studying economics, medical science, IT, engineering, and so on. However, in the chaos of war, the brightest minds have been forced to abandon their studies. Their ambitions have been shattered. As a 22-year-old, Haida, as she said to me in Darfur, and I quote, "I had a dream to study medical science. I was living that dream. Now I have nothing. I do not dream. Sadness is my friend." Ahmed, 20, now in Fachana, Chad, "I cannot afford to dream here." How then to get out of this nightmare and reawaken those dreams? One, those in power need to negotiate a ceasefire and ensure aid is no longer blocked. Two, the region needs to show leadership. Thirdly, donor countries need to show compassion and humanity and funds. But with no sign of a ceasefire, we have to focus instead on two things: safe, sustained and unimpeded humanitarian access across conflict lines, and international support to help sustain the essential services that children rely on to survive. Currently, we have neither. In 2024, UNICEF's appealing for $840 million to help just over 7.5 million of the most vulnerable children in Sudan. Despite the magnitude of needs, last year in 2023, the funding UNICEF sought for nearly 3/4 of children in Sudan was not forthcoming. But amid so many children being overlooked, it's important to remember what families and communities are doing. Most health workers in Sudan have not been paid a penny since the war started, 300 days. But so many of them come to work day after day to help their communities. Communities in Chad, where I spent quite a bit of time, are already desperately short of food and water. They share everything they can with refugees. Towns double in size over the space of a week. People are using every ounce of strength and resilience to support their own communities and those arriving. Yet the people of Sudan are increasingly feeling abandoned by the world. When it comes to the children and the youth of Sudan, the world needs to stop turning a blind eye. Thank you.
Thank you, James. And maybe if I can just take this opportunity to echo what the Secretary General said yesterday during his press conference on his priorities for the year. Referring to the situation in Sudan, the Secretary General said the situation is absolutely horrible. It needs to stop. We need to mobilize the whole of the international community, the neighbors, the countries that have influence on both parties, to do everything possible to stop these horrible atrocities. There is no military solution for Sudan, according to the Secretary General's press conference yesterday. We'll now turn to you for questions in the room, the platform. Okay, we have a question from Lisa Schlein, the Voice of America. Lisa, over to you.
Thank you, Rolando, and good morning, James. Could you tell me a little bit more about the visit that you had? I mean, how long were you there? You mentioned that you were also in Chad. So where did you actually go? I mean, how much access were you able to get anywhere in the country? Outside, I suppose in Chad it was easier, but if you could talk about that. And well, a lot impressed you, so I'm not going to ask you what the most thing was that impressed you, but is any aid getting in anywhere in the country? How are people coping in this absolutely horrible situation? And then is somebody there from the World Health Organization? Because it would be useful to get a little greater insight about the health situation there. You, James, mentioned it, but perhaps we could get a little bit more about the facilities that are available to treat people, whether anyone can actually get there and so forth. Thank you.
Lisa, hi there. Good morning. Thanks so much. On those three things, myself. So I flew into the capital, Geneva of Chad, and then to the Far East, Fachana and Adre, where I was in refugee camps for 3 days, speaking to those people who newly arrived and those people who came at the start, 300 days. Each day, for Sunday, Monday, Tuesday, I think it was those 3 days, I would go in at sort of 6 a.m. With our field chief for one of the Darfurs and the emergency coordinator. We would go into Geneva and to Zelenji, both in West Darfur, one of them 30, 40 kilometers away and one of them 2.5 hours away. At the moment, still, UN workers can't stay overnight in Sudan, and that obviously makes a response more and more difficult. But if still, it gave access to go in and to speak to people in Darfur, and of course to many people who were in those camps in Chad. Aid is getting in. If I just speak from UNICEF's point of view, and colleagues may speak for other agencies, of course, UNICEF is the provider of RUTF, that magic therapeutic food. And so we continue to take that into Sudan in whatever way we can, quite increasingly commonly through that border with Chad. Immense support from the government of Chad to be able to do that. And we start to even rehabilitate, things like I saw solar systems that communities had set up of water systems, Lisa, of 60 solar panels. Again, the looting and devastation is immense. So now that rehabilitation, that reconstruction has to start with communities of that devastation, physical and psychological devastation of what they've seen destroyed. So yes, it is. But when we talk about the bureaucratic and the security obstructions to aid, they're very real, Lisa, and they are costing lives. To give but one example, UNICEF has 20,000 cartons of RUTF. A carton you can equate to a child. That's scientifically how long they would need. 20,000 cartons of that in El Obeid, ELOBEID, for 2 months. That's been blocked due to fighting and no approval from all parties to access. We've had 27 trucks of UNICEF supplies, mixed supplies. I think another 10 from WFP and others from WHO and ICRC, though they can speak to that. That's critical. We need much more than lip service from all parties about bureaucratic and security obstructions. They cost lives, and that needs to stop, and of course a ceasefire. But what we can at least push more so on right now is getting through those obstructions. And I think you asked just in terms of people I met. I would share very quickly one anecdote. I think this gives a sense of the nutrition crisis, but also what people are doing. Nawal is 24. She's a nutritionist. I met her in Darfur. she was 7 months pregnant, Lisa, when she gave birth. The stress brought on an early pregnancy, as we so frequently see. As she was giving birth, her home was hit. So she came under fire, I think, from the air. She gave birth. She then walked for days with her newborn. Her newborn was badly malnourished by the time she got to a UNICEF stabilization center. In her words, Lisa, as a nutritionist, as a mother, she was ashamed that her child was in this state. Obviously, I thought her actions were heroic, and her child now is on the mend. Many other mothers, rather than being in that situation, are burying their children. Thank you.
Thank you, James. We have a question from Peter Kenny of All Africa Global Media. Peter? Can we unmute Peter, please? Okay, I think there may be a problem with Peter's audio. Maybe just if I could take this opportunity to invite any other colleagues online who may want to add about their own agency's efforts in terms of humanitarian relief. Of course, the Secretary General again just referred to this situation in particular, saying we need a ceasefire. We need conditions to deliver aid across the globe. Go ahead, Gabby.
Thank you, James. Just a quick question regarding the most dangerous form of malnutrition. You said that 700,000 children are likely to suffer from this most dangerous form. What is this most dangerous form of hunger? Is there any way to define it? And are there maybe less dangerous forms of hunger that also might be causing issues here? If you have more details on that classification, thank you.
Yeah, sorry. Most dangerous. I tried to be, use normal language. Officially, 3.5 million children are projected to suffer acute malnutrition. The most dangerous form, the one that makes a child 10 times more likely to die from getting, a malaria or cholera, is severe acute malnutrition. So, last year, the number was 2023, 600,000. It is increasing. We are getting very close to record numbers. So 700,000 children are expected to suffer severe acute malnutrition. And this year, they are the ones who require that regular support, which is both RUTF, which is why we need a pipeline. We have a pipeline of RUTF going through the country, requires access, requires funding, and of course requires people on the ground to be able to distribute that. All those things have come under challenge. Distribution and pipeline is one of the things UNICEF has most aggressively sought to take on, and has done so quite successfully, because you may recall last year the RUTF factory, the one place in Sudan that made RUTF, was burnt down. So that added to our challenges. But we have a secured pipeline so far for June. But June is very close when you think it takes 3 months or more in this environment to get RUTF into the country. So it's perilous for that. And that's a crazy number of kids.
Absolutely. Okay, I think while we're waiting for Peter, if you're having a problem with your audio, please feel free to put your question in the chat and I'll be happy to recite that. We'll go back to Lisa, who may have a follow-up. Go ahead, Lisa.
Yeah, well, I did ask whether there was a WHO representative there who could speak about the health situation. But in the meantime, James, I gather a lot of children are dying from the malnutrition, that they're not getting the treatment that they need, and that the lack of health care is affecting other people as well, who may have chronic illnesses or diseases. I see Tarek is coming, so that's good. Thank you.
Yeah, luckily I have the expert to my right. I do know that the number of cholera cases has more than doubled in the last month, with more than 10,000 suspected cases and 292 deaths. But you're absolutely right. It's a health system on its knees. So you have, Lisa, we use these terms so frequently, the perfect storm and so forth. But yes, you have a devastated health system, an ongoing conflict, incredible numbers of severely malnourished children. woefully depleted aid and obstructions to that aid. Now, there is only so much that communities can do among one another and with whatever support that the UNICEFs and WHOs give to avoid, as we say, quite likely tens of thousands of children dying from this. And I think it's a very important question you asked, Lisa, because of course we will talk of verified deaths, and that is very important to look at those grave violations. It's also, I think, UNICEF thinks very important to look at those children who lose their lives through disease and through severe acute malnutrition because of this war.
Thanks, Lisa. And I think you have seen the press release that has been sent yesterday by our regional colleagues for Eastern Mediterranean about the situation in Sudan. But I'll just give you the few lines and some numbers on the disease burden. So the Sudan's health crisis is made much worse by food insecurity. And the latest report indicated nearly 18 million people, 37% of population are food insecure, as James was already speaking. Now, let me give you some numbers on the diseases. Since the ongoing cholera outbreak was declared in September 2023, 11 of Sudan's 18 states have reported cholera with 10,500 cases and 300 deaths recorded by 31st January 2024. While cases appear to show a decreasing trend overall, the actual number of cases and deaths may be much higher since surveillance system accuracy is affected by the access limitation. Now, a few more numbers that I have here is, so beside the cholera, there are reports of measles, malaria, dengue, and other diseases that are reported from several states. And I have some numbers as of 26 January, and I'll be happy to send these numbers. There were 4,650 suspected cases of measles, with 106 associated deaths reported from 11 states, more than 7,000, precisely 7,850 suspected cases of dengue. And we will have our colleague Rahman, who will speak about global dengue situation just a bit later. There were also malaria cases, and there were also cases of respiratory diseases. So the situation is really difficult. And as James was mentioning, definitely the access is one of the issue, but also the scale of this crisis. Myself, I also worked in Darfur 20 years ago, and when you just think about the spaces that colleagues doing humanitarian work have to go, and the lack of infrastructure, it's really difficult to provide services. But again, hopefully colleagues from UNICEF and other agencies, I'm sure will do everything to try to. What James was saying really about the severe acute malnutrition, it's these babies can recover very quickly if there is a possibility to provide them with therapeutic feeding. Babies in a matter of few days can go from the brink of death to be playing in these centers. So I think it's really important that we get funding that is needed, because this is something that Sudan is, unfortunately, it's not always something that is being funded at the level it should be.
Thank you both very much. And I could, on behalf of Peter, who poses his question in the chat, Peter, All Africa Global Media asks, is the situation in Sudan then anarchy? Do we have to get permission from each side at each point that aid must be provided? Who is blocking where? I don't know if either of you can address that, but maybe just to mention, again, referring to what the Secretary General said yesterday, he notes that, of course, the UN, as has been the case, is working with IGAD, the Intergovernmental Authority on Development, and with the African Union and the Arab League, whom he hopes to meet with next week at the Africa Union Summit, he says, to see how we can converge our efforts to bring these two generals, that's Burhan and Dagalo, to the table to have a ceasefire and to finally create conditions also for an effective humanitarian aid delivery. This is, again, according to the Secretary General. I don't know if either of you can address any further about access and permissions.
Peter, I don't think this, I'm sorry, I don't think this will help you hugely. It's just to reiterate that all parties have restricted the movement of aid. So the operating context could not be more difficult. The fighting continues. You're at catastrophic levels of need. The funding nowhere near matches these. And then when we get aid with brave partners on the ground to move it, it can frustratingly and life-threateningly not move for 2 months. Not all aid. I certainly saw stabilisation centres with all the type of support that is required. But I also saw hospitals where the supplies that were in trucks several hundred kilometres away would have saved lives in those hospitals. That costs lives, to be concise.
Yeah, just to maybe to add that 70 to 80% of hospitals in conflict affected states are not functioning anymore. So the access to healthcare has been severely reduced, and that, for example, in Al Jazeera state, we had to stop our operations due to security concerns, and obviously Darfur is of a great concern because hospitals are inaccessible and there is an insecurity that is preventing the delivery of humanitarian assistance.
Thanks both. Okay, Lisa, Charlene, once again for Voice of America. Go ahead, Lisa.
Yeah, this is for you, Rolando. Just sort of a couple of catch-up questions, please. There was the launch of the response plans. I was wondering, I don't know whether Jens is there or not, but whether any pledges have been coming in, what sort of hopefulness there might be in terms of getting the money that is needed. And then also Griffith spoke about the discussions, the meetings that he had with the generals and the prospect of possibly having negotiations going. He said that they agreed to this, but that he was still waiting. Well, is he still waiting? Is there any movement on this front or not? Thank you.
Yeah, thanks, Lisa. Of course, I would refer you to Jens for the details. I mean, I just recited what the hopes of the Secretary General are to try to get the two generals to the table. But of course, I remind you of this very important announcement made just 2 days ago here in Geneva by Mr. Griffiths and Mr. Grandi. And they are, to remind you, colleagues, who were calling or asking for a combined $4.1 billion for the most urgent humanitarian needs. Some monies, as had been announced here and at this seat, had already been pledged. I think the EU was one group that had pledged money, but indeed I would refer you to Jens for the details on the monies that might be coming forward. But of course, this is drastically underfunded, as just recited here by my colleagues. But again, Jens might have more details. I don't believe he's online. If you are Jens, put your hand up, but I don't see you here. Do we have further questions on Sudan for our colleagues here? Okay, Jens does put his hand up. So Jens, please, over to you.
Yeah, thank you, Rolando, and thank you, Lisa. In terms of funding, as you know, it was a launch of the plans. It was not a pledging conference, but I'm sure you know that. I just checked on the Inside Sudan plan, and you have the numbers on the size of that. It's 4% funded, 4%. So that's where we're at. In terms of the discussions and the contacts that have been with the two sides, no, there is no update in the past day on that. I just want you to remind you that Mr. Griffiths also said it was contacts with the generals, but discussions in the humanitarian forum could and will most likely be with what he called empowered representatives. So perhaps not generals in person, but their representatives empowered to negotiate and discuss on their behalf.
Great. Thanks very much for chiming in, Jens. Further questions on Sudan? No, I don't see that's the case. So thank you very, very much, James. Tarek, is maybe if you can stay here, because I know we have going back to WHO shortly. But before that, we'll turn to Marta Hurtado of the UN, the High Commissioner for Human Rights, pardon me, Office of the High Commissioner for Human Rights, where I used to work, in fact. So over to you, Marta, who has updates on Iraq and Haiti, starting with Iraq. Over to you.
Now? Okay. Like we are both making mistakes this morning. Good morning, everyone. Happy New Year to everyone. I haven't been here since, so voila. Let's start again on Iraq. We are troubled by proposed amendments to legislation in Iraq, which, if approved, would impose the death penalty or life imprisonment for engaging in consensual same-sex relations, as well as for certain forms of adultery. We call on the members of parliament to ensure that any legislation is fully in line with Iraq's human rights obligations. This was among the issues raised with deep concern by UN High Commissioner for Human Rights Volker Turk with Iraqi authorities during his mission to Iraq in August last year. For countries which have not abolished the death penalty, the International Covenant on Civil and Political Rights, which Iraq ratified in 1971, strictly limits the death penalty to the most serious crimes, which entails crimes of extreme gravity involving intentional killings. The proposed amendments are all the more alarming in the context of Iraq, given its widening use of the death penalty. More than a dozen prisoners were executed at the end of 2023, and reports have been received indicating that the execution of hundreds of prisoners have been recently authorized. We call on the government to halt all planned executions and establish a moratorium on any imposition of capital punishment with a view to its abolition.
Thank you very much, Marta. We have a question for you from Musa of Al Mayadeen. Musa, s'il vous plaît.
Merci, Orlando. Ça ne concerne pas l'Irak, je vais attendre.
C'est pas okay. Do we have any questions on Iraq before we? No, I don't see that's the case. Let's maybe, before we go back to you, Musa, let's maybe continue with Marta in this case, who has an update as well on Haiti, the monthly record for gang violence killings in Haiti specifically. Marta.
You might have received or about to receive a press release we are issuing on Haiti. UN High Commissioner for Human Rights Volker Turk on Friday issued an urgent warning about the deepening human rights catastrophe in Haiti after figures showed that January was the most violent month in more than 2 years. The already dire human rights situation has deteriorated even further amid unrelenting and expanding gang violence with disastrous consequences for Asians, said Turk. At least 806 people not involved in violent exchanges taking place were killed, injured, or kidnapped in January. In addition, some 300 gang members were killed or injured, bringing the total number of people affected to 1,108, more than 3 times the number recorded in January 2023. Gang violence is affecting all communes in the Port-au-Prince metropolitan area as gang members continue to clash for control of territory and have escalated their activities in areas outside the capital. The intensity of clashes, which in some cases have lasted several hours, may indicate that some gangs have recently received new ammunition. People in areas controlled by gangs have been targeted directly. Gangs also continue to use sexual violence against women and girls as a weapon and spread fear by sharing on social media gruesome photos and videos of killed individuals and women being raped. The impact of this torrent of violence on children continues to be of particular concern. In 2023, 167 children were killed and injured by bullets. Some were executed by gangs or so-called self-defense groups for the suspect support for rivals. The recruitment of children into gangs remained extremely worrisome. In this context of widespread violence, in recent weeks, there have been anti-government street protests and civil unrest, supported by opposition political parties in at least 24 towns across the country, including the capital. Schools, public services, and local businesses have been forced to close. Recently, armed elements have emerged, including some members of the so-called Protected Area Security Bridge, in French, Brigade de Sécurité des Aires Protégées, an informal entity established several years ago by a body in charge of environmental issues. While some protests have turned violence with public and private buildings ransacked, there are also persistent concerns about the necessary and disproportionate use of force by law enforcement. There's more details in the note, but you will receive it later, so I leave it there. Thank you.
Great, thanks very much, Marta. I think maybe we'll just ask Maya, is your question on Haiti?
No, my question is not on Haiti. Thank you.
Okay, I'm sorry. Could we put the volume up? Okay, in this case, let's go back to Musa in this case. If there are no questions on Haiti, okay, we'll take a question from Nina of AFP in the room. Nina.
Yeah, thank you. Hi, Marta. I was just wondering if you had a breakdown of the numbers of how many people were killed among those who, because you have killed, injured, and kidnapped, if you have a breakdown. Thank you. Yeah.
So in January, out of the 1,008 victims of killings, injury, and kidnapping, was 547 victims of killings, 295 victims of injury, and 266 victims of kidnappings.
Thanks for that clarification, Marta. Any other questions on either Iraq, or Haiti before we take other questions? Okay, excuse me, I don't see that's the case. Moussa, vous pouvez poser votre question à Marta.
Merci, Rolando. Bonjour, Marta. Le 30 janvier passé, un commando israélien a attaqué un hôpital à Jenin, tuant 3 Palestiniens et parmi eux, un blessé ou un malade, je ne sais pas quoi. Le lendemain, on a posé la question à votre représentant. Il a dit qu'il n'avait pas assez d'informations. Lundi passé, j'ai posé la même question à Lise et elle m'a dit qu'elle n'a pas assez d'informations et qu'elle allait revenir vers moi pour me donner une réponse. Jusqu'à maintenant, je n'ai rien eu, comme la majorité de cas. Est-ce que finalement, vous avez une position concernant cette attaque en se basant sur le droit international de la guerre ou n'importe quel droit international? Merci.
Bonjour Moussa, vous me permettez, je le dirai en anglais parce que les notes sont en anglais, so c'est mieux être très concrète. Donc, international humanitarian law extends special protection to medical units, which must be protected and respected at all times. We always say that. And medical units lose such special protection as a result of being used outside the humanitarian function, with doesn't look that was the case in Jenin. So I refer to my previous comment. International humanitarian law extends special protection to medical units. Like I know that has been some confusion with you and with us. I'm happy to call you later when I am out of the podium to talk about this case specifically. But to refer what my colleagues have said up until now, we are not in a position to comment on this specific case because we weren't there, and with the information we have is the same that all of you have seen in the videos. And as you know, we can only express with about as events that we have been able to verify. It has not been the case. That's why we haven't given you a specific answer to you on this case, but happy to speak outside the microphone. Thank you.
Okay, we have a few more hands for you. Perhaps, Maya, is this also for Marta?
Yes, thank you very much, Rolando.
Oh, go ahead, please.
Yes, Marta, I know that the High Commissioner for Human Rights, Volker Turk, is going to be visiting San Francisco, Silicon Valley next week. I think it's an invitation from the European Commission. Can you give us a little bit more details who he's going to meet and what is in the agenda of these meetings and how long is he staying in Silicon Valley?
Maya, if I may, I will give you all this information as well later on. My colleagues are currently working on it on the agenda. I know that High Commission is going to meet plenty of stakeholders in San Francisco. Of course, he's going to raise AI, hate speech, and all these really concerning matters regarding human rights and technology. But I can give you a detailed program when we have it and we'll share with you. Of course, no problem about it. Thank you.
Thanks, Marta. We look forward to receiving that. John Zarkostas, France 24.
Yes. Good morning, Marta. It's John.
Go ahead, John.
Hello? Can you hear me?
Yep, go ahead. Yes.
Oh, good morning.
Okay, great.
Yeah.
Yes. Hi. It's a follow-up question to Musa. You have a big team in the OPT, a human rights team, and you have your head of the team in neighboring Jordan who periodically goes into the OPT. Have none of your staff been able to get any information from the Palestinian authorities? I think in this case, the information was released by the Ministry of Health of the OPT. My question is also to Tariq on the podium. Tariq, you have a mechanism in the WHO on attacks on health where you independently verify attacks on health. What has been the case with this incident that Musa raised, if your team have been able to independently verify, and if you have any information on the attacks on health yesterday in Nasser Hospital, where I understand seriously injured inside the hospital by reportedly a sniper from the IDF forces.
Okay, on your first question, John, we don't have a big team in the OPT because, as you know, we haven't received the authorization to renew the visas for the international staff that we had in Israel, on the occupied Palestinian territory. So currently, there's no any international staff in the territory. The head of the office have been granted exceptional visas to go to Gaza. He went recently. You had interviews with him, but currently there's not any international staff. With respect to the national staff, they have been fleeing as anyone else in the OPT. There are people that lived in Gaza with their families and they are not present there. And the staff working in the West Bank do it as better as they can, but as I said before, we need to correct ourselves before speaking up. As well, on this case of the hospital, we did issue a comment on it. I have it in front of my eyes. And what we said is that it seemed to be an extrajudicial execution and in a counter-terrorism operation. But is the information that we had at the moment. We haven't had any further information. That's why we haven't expressed ourselves on this matter again.
Yeah, thanks, John. So I think we addressed this question in one of the press conferences. Look, this reported attacks within the health facilities can only create fear. And people in hospitals should always feel safe. Those should be safe havens where people come to get medical care and should not be afraid for their lives. So if people feel fear to go to health hospitals, to health facilities, hospitals, health centers, obviously that reduces the access to healthcare and can have consequences on the health of the population. Marta already spoke about that health facilities are protected under international humanitarian law, and we keep really repeating our appeal to all parties of the conflict to respect that health workers, ambulances, hospitals, patients should never be a target and should be protected. I'll just give you the latest figures we do have on the number of attacks that, as you know, we are documenting by getting information from different sources. I will repeat again, WHO is monitoring, verifying and reporting these attacks, but we do not attributing blame. We do not have capacity nor mandate to know what weapons have been used and who has committed those attacks. So far, WHO has documented 721 attacks on healthcare in the occupied Palestinian territory since October 7. Out of those 721, 357 attacks in the Gaza, resulting in 645 fatalities and 818 injuries. These attacks have affected 98 healthcare facilities, including 27 hospitals damaged out of 36, and affected 90 ambulances, including 50 which sustained damage. Other 364 attacks happened in the West Bank, resulting in 10 fatalities and 62 injuries. These attacks in the West Bank have affected 44 health facilities, including 15 mobile clinics and 24 ambulances. Happy to send this information by email.
That would be great. Thank you so much, Tarek. And I think Marta has additional information on Jenin, if you could. Thank you.
Yes, just to be clear, I will read out the comment I was referring to that we issued following the Jenin attack. We specifically said that the Israeli security forces claim that claimed that the three men that were killed, were planning attacks against Israelis and hiding in the hospital. The ISF also claimed that one of them had a gun, a claim denied by hospital staff. No exchange of fire was reported. Under applicable international human rights law, firearms may only be used when strictly necessary to prevent an imminent threat to life of serious injury and is otherwise unlawful. The UN Human Rights Office calls on the Israeli authorities to immediately end the unlawful killing of Palestinians in the occupied West Bank, which the office has increasingly documented after the 7th of October, and to provide accountability for all unlawful use of force. If you recall, on the 28th of December, we released a report on West Bank and settlements violence against citizens of the West Bank. We can share with you again, at the time, if I recall correctly, was more than 200 people killed, might be more by now. So we can ask our colleagues in the OPT and the Occupied Palestinian Territory office and share those numbers with you. And let me recall as well that before the 7th of October, already the number of killings and violence in the West Bank was really high and a record number for the last 15 or 20 years. So already the violence in West Bank was striking before the 7th of October, but we can share with you these numbers when we get them. And as well, let me use the opportunity, as we are speaking about OPT flag that you have may seen, we issued yesterday a comment by the High Commissioner on the widespread destruction by Israeli Defense Forces of civilian infrastructure. and how worried we are. So again, let me repeat what is written in this press release and highlight the Article 53 of the Fourth Geneva Convention prohibits destruction by the occupying power of property belonging to private persons, except where such destruction is rendered absolutely necessary by military operations. Destruction carried out to create a buffer zone for general security purpose do not appear consistent with the narrow military operations. And extensive destruction of property, not justified by military necessity, and carried out unlawfully and deliberately amounts to a grave breach of the Fourth Geneva Convention. So this was put out yesterday by us, and the High Commissioner is really, really worried about such destruction. Thank you.
Thank you very much, Marta. Moussa, is this a follow-up for Marta?
Oui, c'est pour Marta. Merci. Si j'ai bien compris, vous avez dit que vous n'avez pas assez d'informations sur cette attaque. Et là, votre réponse, donc c'est une réponse pour moi générale. Ça peut concerner les hôpitaux à Gaza qui sont attaqués depuis le 7 octobre ou n'importe quel hôpital ailleurs. Mais là, on parle d'une situation spécifique. C'est-à-dire, il y a un hôpital, un commando habillé en médecin, en infirmier et infirmière et en femme palestinienne. Cette vidéo, si vous ne l'avez pas, je peux vous l'envoyer, et a été diffusée dans les télévisions du monde entier. Et jusqu'à maintenant, vous n'avez pas assez d'informations. Et ma question est la suivante. Quel est l'avis du Haut Commissariat, la position du Haut Commissariat de M. Volker Turk concernant une attaque dans un hôpital avec des commandos habillés en médecins et infirmiers? C'est ça, donc c'est ce que je cherche vraiment. Merci.
Specifically on being dressed up or not, I don't have the answer, but I can talk to my colleagues on the willful killing or unwillful killing, or if it's a summary execution or not. What I read is the law. There's not an imminent threat. Arms should not be used, and these people, regardless of if they were patients or they had committed crimes, no one can shoot at a person that doesn't have an arm and and is not a threat. So it looks like it was done in not the way it should have been done, but again, is that we can say up until now that what it appears. Thank you.
Thank you very much, Marta. Gabby, was that your hand up and just went back down? Okay. I thought I saw a hand, so I don't see. Oh, there it is again. Gabby, el proceso.
Yes, thank you so much. Thank you very much, Rolando. Yeah, my question maybe to Tariq or Marta, who is going to investigate who are the perpetrators of the attacks against health facilities and hospitals and health staff? Who is going to investigate? I mean, on accountability. Yeah, thank you.
Yeah. Israel, as an occupying power, has the obligation to investigate any crime it's committing on the occupied Palestinian territory.
I think that's pretty clear. Thank you very much for that, Marta. Further questions for Marta? No, I don't see that the case. So thank you very, very much for joining us here. Tariq, thank you for staying with us. I'll give you the honor of maybe introducing your guest who is going to address an update on the global dengue situation.
Yeah, thank you very much. So we have a pleasure to have again Dr. Rahman Velayudhan, who is our lead on dengue. You had opportunity to speak to him a couple of months ago, but we really thought that it would be good to provide you with the update on the global dengue situation. So I'll give the floor immediately to Dr. Velayudhan.
Thank you very much. I hope you can hear me. It is indeed a pleasure to brief you and thank you for giving me this opportunity. Just a brief background. Dengue is most common viral infection transmitted to humans through the bite of a mosquito. And this infection is most common in urban areas and peri-urban areas in tropical and subtropical regions of the world. Majority of the cases are mild, and sometimes there is no symptoms. But for those who have the symptoms, they are usually high fever, headache, body ache, rashes, and nausea. They recover in 1 to 2 weeks' time. But there are cases, especially those who get dengue for the second time, which we call secondary infection. They may need hospital care because they may have a severe dengue, and which has specific warning signs. And if we have severe dengue, naturally you need specialist care in the hospital. There is currently no specific treatment for dengue or severe dengue, so early detection and proper medical care is the key, and it definitely reduces the mortality due to dengue. At present, about 4 billion people are at risk of this disease. In 2023, we reported around 5.5 million cases and 5,000 deaths due to dengue in over 80 countries. The situation, the region of the American region was one of the worst hit, and they had recorded 4.5 million cases, one of the highest in history, of which there were about 2,280 deaths. And the cases, most of them were reported from Brazil, which was around 3 million, though the case fatality rate was 0.4%. The main vector of dengue, which is the Aedes mosquito, they have silently expanded their range, and they have crossed many countries, and today they are present in over 130 countries. And this expansion is continuing mainly in the Mediterranean region, southern parts of South America, parts of Africa, and this is facilitated by environmental changes and climatic conditions which are extremely suitable for their breeding. The dengue season is currently peaking in the southern hemisphere, especially in the American region, and the El Nino phenomenon is still ongoing, and the trend of 2023 is continuing at present, and we are quite concerned about it. In the first 4 weeks of 2024, the American region has reported over 373,000 cases, of which 258 were severe and 57 deaths were reported. All 4 serotypes have been detected in the region. Most of these cases are from Brazil, followed by Paraguay, Colombia, Mexico, and Nicaragua. Brazil has one of the strongest region, and it's a real model for many countries, and the dengue cases are reported as suspected, probable, and confirmed. Brazil is one of the 2 countries in the region of the Americas who are going to introduce the new dengue vaccine, Qdenga, which is produced by Takeda, in its routine schedule for children between 10 to 14 in 512 municipalities with over 100,000 population, and they are targeting to vaccinate around 2.5 million children. Now, in terms of WHO's action, considering all these factors, WHO has assessed the risk of dengue globally and has put dengue at a higher level and supporting all countries around the world to control the current outbreak and prepare the countries to respond to any future outbreaks as monsoon and weather patterns change from region to region. WHO is currently supporting countries to plan and implement priority multisectoral interventions to control the spread of dengue, such as strengthening surveillance, conducting risk stratification, and prioritizing action. We are also helping countries in training clinical experts and updating their guidelines, strengthening mosquito surveillance and control to guide vector control activities, including community participation. And WHO is also leading the global arbovirus initiative, an integrated strategy to tackle all arboviruses, which includes dengue, chikungunya, Zika, and yellow fever. And this is mainly to address the issue of monitoring risks, preventing, preparedness, detecting and response, and building a coalition of partners. The advice WHO gives to countries is, and partners and communities to work together to be alert and be prepared to detect any transmission of dengue and other mosquito-borne disease in the tropical area. The general population can also lower their risk of dengue by avoiding mosquito bite, by using insect repellents or screening their houses, and even especially during the day, because most of these mosquitoes bite during the daytime, and they need to support communities to reduce and eliminate risk, especially reducing mosquito breeding in and around your homes, at places of your work, schools, etc. So I'll stop there. If there's any question, I'll be happy to answer. Thank you.
Thank you very much, Doctor. We have a question for you from, okay, I think Jamil disappeared. So Gabriela Sotomayor of El Proceso of Mexico.
Yes, thank
Go
you
ahead,
very
Gabby.
Thank you very much for this briefing. What are your main concerns regarding Mexico? How is the situation there? Thank you.
Well, the Mexico has recorded a few cases so far, and we are probably, we really need to monitor. And I must say that Mexico also has one of the very good surveillance systems. I have personally seen it. So they will be able to detect and act on it to control the outbreak. So at the moment, it is not alarming, but we hope things will be under control, and we are monitoring the situation.
Thank you very much, Doctor. We have a question now from Paula Dupraz-Dobias of Geneva Solutions. Paula?
Yes, hello. I wanted to ask about Ecuador because it doesn't, I mean, you didn't mention it in the names of countries in South America or in Latin America, but given the El Nino phenomenon, there's been concern that there, as well as in Peru, with the rains and flooding, that the situation may be exacerbated. I also wanted to ask you, and if you have comments about the situation then in Ecuador regarding dengue, but I also wanted to ask about any response by WHO or other humanitarian organizations in Ecuador right now, given the security situation. If you and perhaps any other colleagues could comment on that. I don't know if OCHA or UNHCR are able to comment about the situation in Ecuador.
Thank you. I think later I can provide you the exact figure of dengue, because we are still updating our table. As I said, Ecuador is not in the top 5 countries at the moment, but we are monitoring it. We have our staff office based in Ecuador closely monitoring that. Yeah, on the security situation, I will ask other agencies to help. Thanks.
Yeah, using this as an opportunity to invite other colleagues. Should you have anything to add on the situation in Ecuador, please just put up your hand. But for the meantime, we'll turn to Isabel Sacco of Spanish News Agency.
Yes, good morning. Thank you. I would like to know on the availability of vaccines, if there are enough amount stocks of vaccines to respond to any outbreak in Latin America, and if it would be a need to expand the immunization programs or regarding dengue. Thank you.
In terms of vaccines, frankly, this question we have to address to the company, which is currently Takeda. They are basically scaling up their production. We are told that they have provided 3.2 million doses to Brazil, and other countries, if they have requested, we really don't know. So this is something we have to get it from the company, and I will try to get it in a couple of days. So we really don't know their capacity at the moment. We know they are scaling up, but they haven't provided us exact figures. And I really don't know which countries are opting for vaccinating, because our WHO recommendation given by our strategic advisory group is to vaccinate children in the age group of 6 to 16 years in high transmission areas. So that is very specific to this vaccine, and so it's up to countries to decide where they want to target their intervention.
Thank you very much. Before we go to the Jamil, Isabel, did you have a follow-up to your question?
Yes, yes, thank you. Tell me, would you or would WHO describe this situation that you are seeing regarding to dengue in Latin America as a crisis, as a concerning situation, or as a normal pattern given the season, the peak, that this is the normal season for dengue? Thank you.
Thank you very much. Actually, this is the season for dengue. There's no question about it because it's a summer in the southern hemisphere and you have your rains and things, and it is an ideal condition for mosquitoes to breed. This is definitely the season. Now, whether this is going to have a steep increase, we really don't know. We are in the early stages. Now, we know there is El Nino phenomenon happening in the region. We also know that there are places which could have, which had severe drought. In those areas also, people store water and this breeds mosquitoes. And even in flooded conditions, again, it favors the mosquitoes. So we just need to watch how this season spans out in the next few weeks before we can give you any assessment whether this is a really crisis. But at the moment, the trend in Brazil is little alarming. It is increasing, and the government has even declared an emergency, which is already in the media. So yes, it is the graph is definitely high in Brazil, but we hope other countries it may not be so, but it very much depends on weather patterns as well as the transmission by the mosquito.
Thank you, Doctor. Speaking of Brazil, we turn now to our colleague, our Brazilian correspondent, Jamil Shad, who has a question. Jamil.
Yes, Rolando, can you hear me?
Yes.
So
yes, go ahead.
Bear with me. I have a number of questions on dengue in Brazil. So the first one, Carnival starts tomorrow in Brazil. Is there any specific recommendation from WHO regarding dengue and a massive event that is much bigger than New Year's, World Cup, Olympic Games, anything that you can imagine? Is there any specific recommendation? Secondly, why is it that the world has only one company producing dengue vaccine? Where is WHO in the mobilization of private sector, etc., in the production of vaccines? Third, on the numbers, can you repeat again the numbers of 2024? I think you said 370,000 cases and 258 in Brazil. From where, when to when exactly? And finally, last question, is this a situation in Brazil that is a consequence of political choices in health during the years of Bolsonaro, or it has nothing to do with political choices? Thank you.
Thank you very much for a range of questions. So in terms of Carnival, basically WHO has advice on personal protection. Mainly, we encourage people who are involved in the Carnival to use repellents and protect themselves. And of course, those who are who can cover up with the long sleeves, it is even better. But repellents are definitely a way to protect yourself from day-biting mosquitoes. The second issue regarding in the companies producing vaccine, now you must remember that Takeda vaccine is a second one. The first one was Sanofi vaccine, which had a limited efficacy because it works better in people who had dengue once. And Sanofi has since not been scaling up production, mainly because this challenge remains that they have to test anyone before they vaccinate. So it was the first candidate. The second is Qdenga. Then, of course, we have a range of vaccines under trial, one of which is actually in Brazil, the Butantan vaccine, which is an NIH product which was licensed. And we understand that vaccine is giving real positive results, and we are waiting for their final report for recommendation. So there are candidates, and there are other candidates in other countries as well, all in various stages of studies. And we are encouraging it to come to the WHO Strategic Advisory Group for review and recommendation. In terms of dengue vaccine, the challenge is basic issue is dengue. There are 4 serotypes or four closely related viruses. It is very difficult to find a vaccine which addresses all 4. And this has been the challenge for past 50 years. It is not an easy solution. So it is like having a single key for 4 locks. Not easy. So the problem is most of these vaccines have varying level of efficacy against these 4 viruses, 4 different closely related viruses. So if you want a good vaccine, we have to have at least 60-70% protection against these 4. And we are happy that some of these candidate vaccines are showing that. And we hope more vaccines will come in the coming years. And we are expecting 1 or 2 even this year, later this year. In terms of numbers, now the number I have is basically for the first 4 weeks of this year. And Brazil has 262,247 cases. And this was the number given to me. And we can give you the latest figure later because, as you know, our regional office, PAHO, has a website which is more or less live, constantly updated. So we can give you more accurate numbers. In terms of consequence, I wouldn't wish to comment on this because this health delivery system and how it is managed, it is very much a government priority. But I must say that Brazil has done commendably well for many, many years in addressing dengue, facilitating the introduction of vaccines, and even carrying out this large-scale vaccination right now. They have also been pivotal in testing new vector control methods. So there has been a lot of initiative from Brazil, and we look to Brazil's data mainly for many of our recommendations and things. We also have collaborating centers in Brazil. So overall, Brazil has done well, but we need more. And this is a very difficult disease because it's urban and it is facilitated by a day-biting mosquito. And we really have 4 different viruses. So you may get infected in your lifetime with 1 or 2 or 3 of these. So this is our challenge. And we need to protect ourselves and make a comprehensive approach to deal with this. Thank you.
Thanks to you, Dr. Tariq, thank you for sending the notes. I think Jamil has a follow-up for you, Doctor.
Yes, very quick. You said that we may have 1 or 2 new vaccines by the end of the year. Which ones are they? And secondly, you mentioned the number for Brazil, 262,000. But what is the international number or the world number for that same period? Thank you so much.
Thank you. Actually, from the Brazil and the American region is one of the best we have in reporting. And their reporting system is something we are trying to develop in all regions of WHO. And we will launch a dashboard soon, we are under development. But the regions of the American region has really got a very good dashboard, which you can see on the website. Now, the global number is around 500,000 cases so far. But as I said, in the American region, because of their reporting, they account for 373,000 cases. Now, on the vaccine, we know that Butantan trial data is expected anytime this year. And we are also told that there is a trial going on somewhere in India also and in few other countries, which the national regulatory authorities are screening. So we hope some of those candidates will also come to WHO later this year. So this is the data we have at the moment. Thank you.
Thanks to you. Further questions for Dr. Velayudhan? I don't see that's the case. So I'd like to take this opportunity to thank you very much for the important work in shedding light on this important situation of the global dengue situation, in fact. Okay, Catherine from UNCTAD has an announcement for us. Over to you, Catherine.
Bonjour, je vous invite à la Barbade du 21 au 24 mai 2024 à Bridgetown, la capitale donc de la Barbade. La CNUSED et le gouvernement de la Barbade organisent le premier forum des Nations Unies sur les chaînes d'approvisionnement. Ce sera l'objet de la conférence de presse à laquelle vous êtes invités mardi prochain, le 13 à 16h. Nous serons en duplex avec Bridgetown Et dans cette salle vous aurez comme orateur, le secrétaire général adjoint Pedro Manuel Moreno et l'ambassadeur de la Barbade auprès des Nations Unies et autres organisations internationales, l'ambassadeur Matthew Wilson. À Bridgetown, ce sera l'honorable ministre des Affaires étrangères et du Commerce extérieur, Kiri Simons, qui sera en ligne avec vous. Le transport et la logistique sont les piliers de la mondialisation. Ils relient les chaînes d'approvisionnement et assurent le transport, la diffusion des biens, le commerce mondial. Les chaînes d'approvisionnement, soutenues par des transports et une logistique durable et résiliente, peuvent favoriser la croissance économique, la création d'emplois et la réduction de la pauvreté. Elles sont donc très importantes pour atteindre les objectifs de développement durable. Pour autant, les changements climatiques et les événements induits qui sont souvent extrêmes, les tensions géopolitiques, les pénuries, que ce soit de carburant ou d'autres matières premières, les coûts d'expédition élevés, les tensions commerciales comme elles émergent entre différents acteurs de la mondialisation, une pandémie mondiale du type Covid-19 et l'impératif de durabilité qui nécessite des investissements importants posent des problèmes sérieux à une mondialisation durable et en croissance. Les pays en développement, bien sûr, sont les plus vulnérables face à ces enjeux, et parmi eux, les petits États insulaires en développement, comme la Barbade. Ils sont le plus durement touchés. On peut aussi mentionner les pays enclavés, les petits États enclavés, qui n'ont pas d'accès aux ports, aux océans et mers. Il faut garder en tête que 80% du volume du commerce international passe par le transport maritime. Quand il y a un point de pourcentage d'augmentation des coûts de transport sur les prix, la hausse dans les petits États insulaires en développement, par exemple, est 5 fois plus élevée. Donc, ils sont vraiment très, très mal placés dans la carte mondiale du commerce international. Il faut donc les aider à faire face à ces enjeux, comme tous les autres pays en développement par ailleurs. Ce sera donc l'enjeu de ce forum où les décideurs politiques, les leaders de l'industrie et les gens de terrain discuteront de solutions innovantes pour relever les défis du transport et de la logistique et exploiter les opportunités de ces chaînes de valeur durables, inclusives et résilientes. Comment aider ces pays? Donc, on a dit, c'était par des solutions innovantes dans le cadre d'une forte collaboration internationale, accompagnée de partenariats publics-privés. Tous les acteurs doivent être sur la même longueur d'onde pour résoudre ces problèmes qui sont vraiment cruciaux. Voilà, donc je vais vous envoyer un lien. On est en train de faire des tests, on enverra le lien avant bien sûr mardi et j'espère que vous serez en ligne ou dans cette salle pour suivre cette conférence de presse. Merci.
Merci à toi, Catherine. Questions for Catherine? No, I don't see that's the case. Thank you once again. Merci encore. We have just a couple of announcements in terms of the human rights treaty bodies. The Committee on the Elimination of Discrimination Against Women will be reviewing the Central African Republic today. And on Monday, the Committee on the Economic, Social, and Cultural Rights will open its 75th session, which will last for 3 weeks, during which the committee will review reports of Romania, Mauritania, Ireland, Iraq, Indonesia, and Sweden. There's a media advisory that was shared with you earlier. Vous avez reçu toutes les informations sur les conférences de presse mardi prochain for CNUSED. And then just the last note is a couple of observances, which I'd like to flag. Tomorrow is the Lunar New Year, and there's a video message from the Secretary General, through which he says he sends his warmest greetings as we usher in the year of the dragon. The dragon symbolizes energy, wisdom, protection, and good luck, and we need these qualities to rise to today's global challenges. Indeed, we do. And then Sunday, we have the International Day of Women and Girls in Science. Among other things, the Secretary General notes that from climate change to health to artificial intelligence, the equal participation of women and girls in scientific discovery and innovation is the only way to ensure that science works for everyone. So those messages were shared with you. Any questions for me? No, I don't see it the case. So I wish you a very nice weekend and happy Lunar New Year.